Could you quickly give us an overview of what I Am Whole is?
I Am Whole is. Okay, so I Am Whole is an anti-stigma mental health campaign that we started 3 years ago.
Yeah.
And the idea is that it aims to help people speak out, seek help, and get support around their mental health difficulties. So we really want to help normalise the conversation around mental health and get people talking and saying, actually, like, it's okay to share your experiences and to talk about things, and that's going to help people.
What way is I Am Whole being represented this year, and what is your vision for the future?
Good question. So I Am Whole's really evolved from when we first started it. In the first year, it was literally like one day of action, everything go, first day. And then we were done. We're like, everyone's done it, great, cool, we're done, finished. So this year we're trying to evolve the campaign. And Whole Hour is our big new initiative, or it started last year, but it's kind of flashy and new. And the idea is that people take an hour out of their day to do something positive for their mental well-being on World Mental Health Day. And it's really just an attempt to champion self-care. And we know that taking an hour to do something good isn't going to solve the issue, but actually it's a recognition that self-care and looking after yourself is really important. And if people consciously do it on one day, our hope is that they do it time and time again. Going into the future, I think Whole Hour is a really great initiative and I want to see it grow. I think I just want everyone in the world to be part of I Am Whole, which is a big ambition, but I feel like we can do it. It's from where it started, when it was literally just in a local YMCA in Brighton, to where it is now, where there's countries all around the world doing it. It's really cool. So I'm hoping just to grow that and getting more people involved in it.
Yeah, interesting. Have you got any new insights from YMCA 175?
I think the importance of mental health, and obviously I know that in my context, in my country, and speaking to young people, it's something that we come across a lot, and people always talk about mental health.
Yeah.
But actually it's something that people all over the world are talking about, and that's really cool because you don't really expect it, and it is literally on the top of the agenda. So I think that's been really important to listen. And also I haven't been to many sessions because I've been doing focus groups and stuff. But just the expertise that's in the Federation is really cool. And YMCAs around the world are doing some really innovative programs. And 175 has been a really great chance for everyone to meet and kind of share best practices. Yeah. And so actually this is really cool happening in my country. Why don't you take and do it in yours as well? So that's been really good.
Yeah. Have you heard anything, even though I repeat already, interesting from countries such as Australia, America, even China or Africa?
Yes, I think the prevalence of mental health and talk around mental health there has been really, really interesting. Sometimes we think that it's just kind of us I think we get stuck in a little bit of a UK Ireland bubble, and we think that, we're the only ones that are talking about this, but actually it is all over the world. And while some of the language is different and what people talk about, we talk about stigma and stereotypes, it's different in different countries. But actually we're all fighting for the same thing. And we all want to tackle the stigma and get people talking, which is really cool. And I think some people are probably, the conversation isn't as advanced in other countries. And I know in some countries it's harder to talk about it. But people are still having those conversations, and YMCA is leading the way in that, so that's really cool.
Thank you very much.
You're welcome, thank you.